Hey there, and welcome back to this week's videos. This week I wanted to talk about crisis intervention and suicide assessment. As social workers, we come in contact with a lot of clients, especially if you're focusing on the clinical aspect. I think it's common in our field to come across clients who may have some sort of suicide ideation or may present some symptoms that kind of trigger those thoughts in your mind that, hey, this patient could potentially commit suicide or be thinking about committing suicide. So I want to talk a little bit about that and also kind of what I would do or what I think someone should do when this problem presents itself. So in my current field placement as a case manager, I do work with clients who some of them have gone to the hospital because they attempted suicide or they had thoughts of suicide, and then they're discharged, and then I'm assigned their case manager. So over the next few weeks of them being discharged from the hospital, I really want to monitor them, make sure that I don't see any signs or symptoms of like uncontrolled depression or signs of suicide ideations. And as social workers, I think that we should be comfortable just straight up asking people, are you having any thoughts of suicide? Are you having any thoughts of hurting yourselves or others? I've asked some of my clients who just seem really down on the phone. They don't seem like they're communicating well. And, I'll straight up ask them, have you wished that you were dead or that you didn't wake up in the past few days? And depending off what they say on that, we'll kind of gear the conversation. I've straight up ask my clients, have you ever had any actual thoughts of killing yourself? And it depends how they answer that. Sometimes clients will say, it's crossed my mind, but I would never actually act on it. I kind of dive a little bit deeper. Well, how many times has it crossed your mind? When was the last time it crossed your mind? Have you told anyone about this? So I guess it kind of all just depends how the client responds to questions like that, as far as how you as a social worker would handle it. If a client does say that they are having thoughts of suicide, then I kind of ask them, well, have you developed a plan? How would you kill yourself if you were to move forward with this? See what they answer. Sometimes they may say, they would kill themselves with a weapon. Sometimes they might say that they would overdose on medications that they have prescriptions. So that also kind of steers the conversation. I had one client in the past who said that they were feeling suicidal and the way that they would do this is through shooting themselves. So my next question was, okay, do you have any weapons in the house? And they did report that they had a gun in the house. And then the next step would kind of be, well, is there a way that we can get that gun out of the house? Is there a way that we can tell a friend or family that you're having these thoughts and to have them remove the weapon? So it kind of goes into how the client responds to then how you respond. And then you also want to think about, if they're a little bit vague and just saying they've had thoughts of suicide, but they don't really have a plan. Well, you can ask them, have you thought of means of how you would do it? Have you told anyone about this? Have you had suicide thoughts in the past? Have you ever had a suicide attempt in the past? Do you have any history of family members who've had suicide attempts? So I think it could be a stressful conversation, but it can also be a really good conversation that needs to happen with our clients. They're probably feeling extremely vulnerable when they share this information with you. So I think it's crucial the way that social workers handle this. I also think it's important that, if you are concerned for your clients or someone associated with your client, their safety, that you act appropriately. I think that it needs to be escalated if you feel like they are at risk for suicide, whether that is, asking them if you can speak to someone they live with, speak with a parent if it's a adolescent or something, and even going as far as calling 911, getting that person to the hospital where they can be safe and under the care of medical professionals. As social workers, we always want to make sure that our clients are safe. So I think these are tough conversations that have to happen when we are working in the clinical field of social work. So I would love to hear your guys' stories if you've ever worked with clients who have expressed suicide ideation, how you handled it. And that's it. Thank you.